The key takeaway as a reader is, evolve or die. What I've seen today, more so than 5 and 10 years ago, everybody's super busy doing blocking and tackling marketing programs, and they don't have time to think. So as the landscape's changing, they really haven't been able to dig deep into it. And myself and the other co-authors, we're in a think tank group, and we all came to this conclusion, and it was kind of inspiring. It's like, we should write a book so these people can quickly get a synopsis of, here's what's changing in the industry, and this is what you need to do to keep up.
Right now, we're kind of in the perfect storm of healthcare. A couple different trends have been taking place for a while now in pharmaceutical and healthcare marketing. To start, specialty products and niche products to niche patient populations have been on the rise. It tends to be a more defensible space for a brand today to still be able to charge a premium. The other big trend would be patient centricity. As the power shifts away from the provider who has less and less choices about what they're going to prescribe and more towards the patient who's getting more and more involved in their care, and where there's underlying systems that are evolving designed to incent and motivate the patient to take more active engagement in their care, the patient is becoming the hub of the wheel, if you will. The third trend that we're seeing is this shift towards digital, this kind of massive shifting of budgets from offline media towards more measurable, engaging online media.
We've been getting so many requests from our customers because it's no longer in the future, it's happening here today. A lot of the changes that we've seen from healthcare reform have been happening for a long time. The push to improving quality, the push to controlling the cost of care, and really applying it to the broadest number of people. To achieve those three things, provider networks and payers actually need to rethink about how they structure their business, how they care for their patients. And what that has driven is for provider systems to start to take on more risk, meaning that they're really focused on that patient experience and control of that outcomes while taking on some of the risk of the cost of care.
Pharmaceutical companies have had to rethink about how they engaged with their customers through their customer-facing organizations. The healthcare market has changed quite drastically, and we've known that this change is going to be happening for the last 4 or 5 years, but in the last 2 years in particular, we've seen a lot of changes in the marketplace, and we know that health plans are preparing to more efficiently manage their populations. And now we're seeing with providers more and more interested in understanding how they more effectively manage these patient populations. And one of the things they're being asked to do is to manage these patients through evidence-based protocols, evidence-based guidelines. By doing this effectively, they collectively share in that better outcome, which essentially means that they'll not only lower the cost of care in the short term, but also in the long term.
Regional marketing for the manufacturers that I've worked with, and I've worked with dozens, it's working very well. And one great example is, for one company, analysis was done. They divided the country into 5 different virtual regions. With no tactical changes at all, they were able to grow their business 18%. It was a $1 billion drug. And it was really educating the sales professionals that in your market, your biggest lever is X. In your market, your biggest lever is Y. And just with that knowledge, they started seeing the results.
As I look to the future, I think we're in a very interesting period right now. For the next 2 to 3 years, I think there's going to be a very interesting period because I think a lot of things are going to happen in the marketplace.
The future state of the healthcare systems remains very uncertain. There's a lot of different models and pilots that are being experimented with right now.
With the passing of the ACA and the digital disruption that's happening today, as well as the disempowerment that's happening among physicians and the shifting power between the provider and the payer, today just seems like a very ideal time to really sit back and say, what does the future have in store?